Hi, my name is mark-sehl, and I'm a psychoanalyst, and I'm having a series of talks on psychotherapy, what makes for a good psychotherapy session. This is both for the consumer and for people who are interested in coming into therapy so that they can learn more about my approach. Last time we talked about what makes for a good psychotherapy session. We talked a lot about judgment and how people expect to be judged when they come into this office. There's a lot of judgment that we all carry inside us, and that interferes with our life, with our perceptions of ourselves, with our relationships with other people. And how do we get that judgment? We're not born with it, so it's something that we acquire, and it's something that we acquire by how we're raised. For instance, take a child who wants something, say it wants a piece of candy, and mother or father might chastise the child for going for the second time into the candy jar and criticize the child. Might even sometimes be more physically aggressive with the child to try to restrain the child. And the child gets very frustrated and really doesn't have a voice. The child might cry, and the child's crying might disturb the parent, and the parent might get angrier, raise its voice, and the child then doesn't have a voice. The parents can have a voice, but the child really doesn't. They're small, they're vulnerable. So where does their frustration, anger go? It goes inside, it's internalized. And this is a very unfortunate experience and leads to a lot of problems in mental health. If you can't have a voice, you still have the aggression inside. So if you don't have any way to express it, Hyman Spotnitz decided that this was the fundamental reason why people become sick. If you don't have a voice to express your anger and aggression, then it results in depression. Person attacks the self. I'm worthless, I'm no good, I'm a piece of shit. In psychosomatic illness, people develop ulcers, skin conditions, and in schizophrenia, you can have severe disturbances in thought confusion. So we try to reverse that detrimental damage that's done to the individual by certain techniques that we have in modern psychoanalysis. Modern psychoanalysis is really about the emotional exchange between patient and therapist. It's not so much based on interpretation and insight as was classical psychoanalysis. So that's where the judgment comes from, and it's something we learn and acquire. In the first session we talked about, I mentioned a quote by D.W. Winnicott, and he said, "It's joy to be discovered and disaster not to be found." In classical analysis, there was a lot of reliance on interpretation and questions, challenges to the defenses, which really put patients off and made them feel even more criticized. So we attempt not to ask intrusive questions. It's very important for the patient to be able to feel that they're going to be coming to this room. Patients carry a lot of shame inside them because of the internalization of aggression which they couldn't express. They carry a lot of things in them that they never have been able to talk about to other people. And this could be their first experience where they sit down and have the possibility of being understood and being listened to. And that possibility is going to remain there, with the therapist being the person who's responsible for conducting a good therapy session, so that the person does walk away feeling, well, he didn't yell at me, he didn't scream at me, he didn't tell me I was stupid for thinking what I was thinking. He really listened. And if that happens, then you may have somebody who can take to therapy where they may have never had a good experience before. And as we said in the first time we talked, the first first talk that we had about a week ago. We want to know about the former experiences that persons had with therapists, because once we know that, we can get an idea of if they were able to talk to their therapist about what the disappointing experience was, and if not, then we want to see if they can be able to talk about it with us, because if that doesn't happen, the person could build up resentment and disappointment and leave therapy, and that often happens with many therapies. So this is called Therapy for the Heart, and I named it Therapy for the Heart because when I was searching around for a name and I was excited to get on YouTube because I wanted to do this, it just came to my mind. I actually was listening to music at the time also. So music has a lot to do with the heart, and really, if you watch somebody watching a movie and they don't cry too much about circumstances in their life, but all of a sudden they might cry about something that happens in the movie, or a chord of music could touch something off in someone that will make them feel very emotional. So it's Therapy for the Heart, and that's the site. And people say, he speaks from the heart. Well, they're really saying he speaks with feeling and emotion, or she speaks with feeling or emotion. I remember a quote from The Little Princess that said, "It is with the heart that one sees rightly. What is essential is invisible to the eye." And that's true. Many of our problems are of our emotional world that is not so accessible, because our emotional world was, we weren't free. We weren't free to talk, as I explained before, with the reaction of the child who wants something. And if it's scolded and reprimanded, what happens is that it gets to feel that its needs are bad, and it's bad for wanting. So we want to hear the story of somebody's life when they come in to see us, and that story is going to unfold over time. It's going to take some time. It's like in The Little Prince, which is a good book because it really is. It talks a lot about it's like therapy, where the fox tells a little prince that in order to get tamed, you have to meet me, slowly, gradually, over time, in the same spots, like therapy, in the same spots. You're going to come every week, and eventually we'll get to know each other, and that will develop a relationship, and that's very much what happens in therapy. So we have, in the well-conducted therapy, we have understanding instead of judgment, interest instead of indifference, and we don't want to fit a person into a preconceived notion of what we think they should do, particularly if we don't know who they are. One time, a therapist reported to me that they saw somebody in there for a consultation, and the person said they didn't want to talk about the past. They didn't have any interest in the past. They felt it was irrelevant to what they need to do in their current life. And the therapist got rid of them. That was because of some preconceived notion that this therapist had, that unless you talk about the past, you're not going to have a successful experience. Well, it is true that if you don't remember the past, you're bound to repeat it. But, if somebody comes into the room and that's where they are, you're not going to ask them to talk about something they don't want to talk about. But therapists do that. Somebody came in to see me one time, and she said, "Dr. Sell," she said, I never came to therapy because I thought I had to talk about the past." And I said, no, you don't have to talk about it. You just come and talk. A few years later, she was able to talk about the past, and it became evident to me why she couldn't. It was very painful, and that's not an easy thing to do, and therapists have to respect that and not challenge somebody's defenses like the other therapist did. As a matter of fact, in modern psychoanalysis, and in other therapies too, it's not just the caveat of modern psychoanalysis, you want to join a resistance. That's a resistance. When somebody doesn't want to talk about something, but they have good reason to, so you want to join it, and say that's okay. You don't have to do something you don't want to do. You know, so many times we're told you have to do this and you have to do that by our parents, you know. And that's where we get it from. The therapist also struggles with their own internal conflicts, just as patients do. If you remember the sequence in treatment, and that therapist was very uncomfortable with his patient's, very attractive patient's, sexual feelings toward him. And she was also very seductive, and he couldn't handle it. He became very uncomfortable. And the treatment really floundered because of that. So in my training, I was trained by Dr. Jerry Lucas, and I want to give him credit because a lot of the things that I say here are in part because of what he taught me as a wonderful mentor. So he had a training group, and he still has, where therapists say everything that comes to their mind in a group, which is difficult to. It's easy to say it in individual therapy or group therapy. I'm not in group therapy, but individual therapy or individual supervision. But when it comes to a group, it's more challenging, but a very good experience. So that's how we learned how to be comfortable with all our thoughts and feelings. So anything that's suppressed, doesn't really become part of yourself. That's what therapy really is all about, is becoming. If you speak freely, it's free speak. Psychoanalysis is free speak. So if you can speak freely, you become acquainted with all these different thoughts and feelings that you tend to suppress, push away. But those feelings and thoughts also can get in our way if we don't understand them, and if we have to push them out of the way, because, like an aggressive thought, for instance, and many patients say, well, I felt like killing her or killing him. Oh, but I shouldn't think that way. And why? The thought is just a thought. It's not an action. But because sometimes people, the way they're raised, they interpret thoughts as actions. But if you can't think of something, you can't have an intimate relationship or think of a hateful thought, you're really not loving someone, because you're only part love. You know, it's part being nice, it's part being lovey, it's part being sweet. But there's another part of loving someone and being in love and being in a relationship that also includes these other feelings of hate and bitterness. And we need to accept them so we don't act them out. One of the things that happened when I was running my training group, for instance, in terms of not acting them out, was I had somebody in the group who didn't show for a few times, and I reined her in back into the group. And the reason why she didn't show was because she was very embarrassed about her sexual feelings towards her patients, and was reluctant to talk about it. Once she did, in the training group, she became much more comfortable, because she found out that other people also, in turn, had their own similar feelings about being uncomfortable with those kinds of sexual feelings. And once they talked about it, they could handle it better with their patients. It's, you know, they were a step above the therapist in treatment, who really didn't get a handle on that for a while. I wanted to see if I can give you an example. Like, I don't know if I mentioned before, but psychoanalysis really relies on the concepts of transference and resistance and countertransference. And that's what differentiates. It's also wanting to know, you know, what's really in one's unconscious mind. I mean, wanting to know what that is, and having the method and the techniques to get there. I mean, many people have problems with. Many people who have problems think if they can go read a book or a self-help book, then that will, you know, get them better, and they'll get over their problems. The problem is that self-help books don't really point to the fact that there's, besides the intention to want to get better, there's something that goes against that intention. It's like will and counter-will. And unless you get a handle on that, you're not going to. You can read all you want, but you can't really get to the bottom of why you can't change your behavior. Sometimes there's a very self-destructive aspect to people, and they don't really realize it. So you have to again come down to the emotional level. Therapy for the heart. There was a tape I saw recently at a conference by Dr. Acheron. I believe that's how it's pronounced. And in this tape, it was a tape of a infant who had premature delivery, and the infant was, I think it was a 3-month-old infant, and it was autistic. And in the videotape, it was very sad because you could see how detached the child was. The child the mother was there, and there was a therapist there also, and the child was just looking away. It couldn't make contact with either the mother or the therapist. And it was just staring off away into space. Now, if you don't have contact, you can't survive. There had been instances where children who weren't held enough or couldn't make the important kind of contact, emotional and physical, that you need in order to thrive, and they would die eventually. So there was this situation, and the therapist made an intervention, and she said to the mother and to the child, talking to them both at the same time, she said, you've had a very difficult delivery. You both had a very, very hard delivery. And at that moment, the mother started to cry. She turned her head away and started to cry. And her child looked up at her and started to cry also. What a moment. Talk about emotions and, how they are so essential. The mother most likely, now I don't know if the therapist talked about this, but most likely blamed herself for the autism of her child. Parents tend to do that, and a lot of self-blame, as we talked about before, internalized. So that may be the first time that somebody said to her, you had a very difficult time, and that's what made her cry. And also her baby joined with her in crying together, and that was the connection. It makes me feel very emotional when I speak about it, because if you think about it, how many children are going to be missing that kind of intervention in their lives? And those kinds of interventions are what is going to happen in therapy, actually. If a child says to its mother, gee, I can't make any friends in school. The mother or father says, well, what's the matter with you? What's the matter with you? You should be able to make friends. And the child then takes that on and, doesn't hear something like, well, it's very difficult to be a new kid in school. So this tape really struck me, and that one intervention was going to be continued with that therapist, so that with the mother and child, so that there would be some hope that this child would not remain detached. And again, in the therapy, what we can do with somebody that comes in when has a very kind of self-recriminating attitude towards them because they couldn't make friends, we can say something to them like, well, it must have been very hard for you, to be a new kid in the school like that. Instead of, what's the matter with you? What's the matter with you? I'll give you a slap in the head. Go back there and make some friends. So it's an emotional world that we work in, that we work with, and hopefully we can help people recover their emotions that give them trouble in life and interfere with them in terms of not being able to have a good, loving relationship. Many women come to me and say they can't find an emotionally available man. And then they might say, well, gee, my father was not very emotional. So what they're doing in repetition with one relationship after another is repeating, finding unavailable people. Now, what's that all about? Why would they go and find an emotionally unavailable person just like their father? There was a book once, I can't remember the whole title, Women Who Love Too Much, and the men that they find, I don't know, I can't remember the whole title, but anyways, it really struck many women's hearts because they can really identify with that. Now, why that happens, that's why people need to get into therapy, because somehow there's a need to repeat that instead of remember it. And I mentioned before about psychoanalysis being involved with transference and resistance and countertransference, and that's one of the things that distinguishes it from other kinds of therapies that more rely on the cognitive approach. I'll give you an example of trying to define those terms for you. One time somebody came to see me for a consultation. And he continued with me, and along the first 3 or 4 months, he happened to ask me, he said, "Dr. Sell, do you live here?" And I said, "Oh, that's an interesting question. What makes you ask that?" And he said, "Oh, I just want to know." And I said, "Yeah, I might answer the question at some point, but I'd like to know also what interests you about that." So he said, "What would be the difference," I asked him, "between 9th Street becomes very noisy sometimes with the fire engines here." So I said, what difference would it be for you if I lived here versus if I didn't live here? And he said, "Well, if you see me at 7 o'clock in the morning." And I said, "Yes." And he said, "Well, if you lived here, it would be one thing, and if you didn't live here, it would be another." And I said, "Well, yeah, what would the difference be?" And he said, "Well, if you didn't live here and you came all the way and you had to walk all the way or take a bus or whatever to see me at 7 o'clock in the morning, I would feel really special." See? So there you have a number of things happening. He's talking to me about what he wants, which is to be special. Now, his transference to me would be that he would probably experience me as somebody who didn't want him to be special, didn't feel like he could be very special to me, because that's what he missed in his upbringing. So that would be a transference that he would have to me. A transference resistance would be that he would want me to gratify those needs for him to be special, to make him special, rather than to remember how unspecial he felt, which is a very sad thing to remember, because he was treated very abusively and sometimes physically abusive. So he did not have that feeling of being special. But in some way, what the therapy has to do is produce with the relationship between us some feeling of specialness, because in order, if that doesn't happen, he's not going to have the wherewithal and the feeling to sustain a treatment that's going to be pretty difficult, because essentially he's going to need to remember at some point what those feelings were, but not right away. Not right away. And also because he was abused, he's going to need to be able to be aggressive with me, so that he can turn that internalization that's inside and put it outside, really on me eventually, so he doesn't have to feel so timid and self-blaming about what happened to him, which is what children do. They say, "Well, it must have been my fault. That's why I was ridiculed. I must have done something wrong. It must have been me. It can't be the parents. I can't attack the parents, because, what happens if you attack the parents? They'll attack you back. They'll leave. They'll desert you." So that's. I hope that it was a little example of a piece of what transference is and what transference resistance is. They're complicated terms, but if you think about them, and if I can describe them to you a little bit, and hope that I can, it will give you some idea of what we're talking about when you hear those words. There's also countertransference. Countertransference is a therapist's reaction to the person, and like the woman who couldn't listen to her patient's sexual feelings toward her and couldn't accept her own sexual feelings. So a countertransference in this instance would be if the patient says, "Well, do you live here, Dr. Sell?" And a therapist could answer that question, and it without thinking about it, because they might be afraid if they don't answer a question, then the patient's going to be angry with them. And that's a major resistance, often unconscious, that the therapist has. The therapist might think, well, they feel guilty if they don't answer the question, because they feel like they need to gratify the patient. And that's due to their own thing about wanting gratification and being not wanting to see somebody else deprived. And we do gratify patients a lot. I mean, the whole being in therapy is a gratification of sorts. So, but we also don't want to just gratify, because then we don't get those questions answered of what's important to this person wanting to know whether I live here or not. They don't really want to know whether I live here or not. If I answered the question, I wouldn't have gotten all the information about that person wanting to be special. So I hope I've brought some awareness to you today about what therapy is and what a good therapy session can be about, and what a therapist's responsibility is in that session to be the most effective person that he or she can be for that person that we're working with. We will have another video maybe within a week, possibly before that, and I invite you to come back and tune in. If you could leave a comment in the comment section on the page that you're watching, on below you can type in a few words. That will help me gauge myself in terms of how I'm doing in terms of conveying to you what I'd like you to be informed about. So if you could leave a comment, if you wanted to like the page, you can do that. That would be nice. If you don't like it, you don't have to do that either. So do what you want, but I'd like some input if you can give it to me. And if you need to subscribe, there's a section on there also where you can subscribe to this channel. So it's been very nice having you here. It feels like to me like it's a live audience, but it's really not. But anyway, this is Dr. Mark-Sehl signing off, and thank you. Bye-bye.